Hi, everyone. My name is Betti Grab, and I am the manager of Cardiopulmonary Services and Vascular Access Services here at City of Hope, Phoenix. And since we are getting ready to come into the season where we have a lot of air quality alerts, I just wanted to talk to everybody about the effect of air quality on health and well-being. So I am, a little bit about me, so I am a registered respiratory therapist. I've been doing this for 34 years. I like to say I started when I was 2, but that's not true. I'm also an asthmatic. I'm adult critical care specialist. I am licensed in the state of Arizona to be a respiratory therapist, and I'm also a vascular access specialist that's board certified. And I have my master's degree in healthcare administration. So I think I can talk to you about these things. I'm gonna press play. So we're going to talk to you about breathing easy and the effect of air quality on health and well-being. And it's not just about those people with lung cancer or lung disease. It affects everyone. So when we're done with this little talk, I'd like everyone to understand the effect on air quality and how it affects them, why you should pay attention to air quality alerts, and what you can do to protect yourself if there is poor air quality. And in Phoenix, that happens a lot. So these are just some headlines and articles that I snagged just to put on there. And it's not to scare anyone. I mean, the one that says the U.S. National Weather Service has issued an air quality alert for Surprise. You see that happened on December 14th of this year. So it happens a lot. I noticed driving to work this morning that there was also an air quality alert on this overhead freeway screens. So it is something to be aware of. So how did we get here? I kind of joke and tell people that my sister and I are part-time natives. My grandparents moved out to Arizona in 1973 from the Detroit area. And I just remember coming out as a kid. My parents would bring us out any break we had from school. And just those mountains and everything seemed that they were right on top of you and could reach out and touch them. And you look at these pictures. So the first one is January 15th, 2009. And then the one over on the right is February 3rd, 2020. And I wanted to get pictures of that were the same. You know, both of them happened in the winter. So not just winter versus summer, but, you know, how did we get here? How did we get to the big brown cloud? And those days, you know, that I used to remember as a kid aren't here anymore. Or if they are, they're very, very rare. So we have 2 types of pollution that you have to work or deal with. The first one is ozone, and that's the invisible pollution. You've heard about the ozone layer and the hole in the ozone layer. And that is an invisible pollution. And what it does is it affects your skin, it affects, you know, it can cause cancers. And in those with lung conditions, basically, you think about it as burning the lungs. So what it can do is make people that have lung diseases worse and cause that disease to worsen. And it also can cause fibrosis in the lungs. So the lungs become stiff and it's more difficult to get oxygen into your system because that area now is full of fibers and it's hard and gas does not pass through that very easy. So ozone days, you just got to pay attention to. Do I think that you need to run around with a mask on anytime we have an ozone day? No. You know, just be aware of it and be cautious. The big thing I want everyone to pay attention to is the particulate matter or the PM pollution. So that's the big brown cloud that we're used to seeing. So how did this happen? Why did we go from seeing beautiful clear skies in the Phoenix area to the big brown cloud that we see almost every day? So Phoenix in general, and I'm talking about the valley in general, has exploded in population. So with increased population, there are more cars, and the combustion from cars, from increased vehicle traffic, can contribute to that particulate matter. So, and then also with more population, we need more power, we need more industry, Things are growing, lots of construction. So there's all those emissions that we now have to deal with that contribute to the big brown cloud. Dust. We don't have dust here in Arizona, no. So windy days, during the summertime when we have haboobs or the dust storms, those are really big contributors to the big brown cloud. Also, construction, because the dirt is being moved around, and sometimes even with farming, because they have to till the soil and everything else. The other contributing factor are wildfires, especially in the summertime when everything is super, super dry. There's that risk, even though they may not happen in general in the Phoenix area, if they're happening in the mountains around the Phoenix area, or even from California and Canada, we've gotten smoke, just depending on how the jet stream is. I'm not a meteorologist, so I'm not going to go into detail on that. I just know that the jet stream really contributes to that. Pollen, more pollen, more people, more plants, more pollen is what I like to look at it. And especially those that want to bring their plants from where they came from and try to make Arizona closer to home. So grasses, non-native plants, not xeriscape landscaping plants. But yes, pollen happens even without those things. You think back when we used to have lots of citrus growing here in the valley, that would contribute to it. When you go up north, say to Flag or Prescott, those trees like pine trees, all of those when they're in bloom, that contributes to it as well. Palo Verde is another one that contributes to it a lot. And then my favorite, which I call the yellow pom-poms of death, are the sweet acacias. Those send my asthma and allergies through the roof. So yes, those definitely contribute. And then the biggest reason why we wanted to have this conversation right now is no burn days. And there are so many people that just don't think that it's a big deal to follow the rules on no burn days, especially around the holidays. You know, everybody wants to be outside. The weather's beautiful. Let's have a fire. Let's have a bonfire or a pit fire or something. But they don't realize the effect it has on the pollution. So again, there's burning, it goes into the air. I remember I used to work downtown, and driving from the West Valley or even the East Valley into Phoenix, you would come to a certain part on the I-10 and it would just smell like burning wood, and it looked foggy because there was just so much particulate matter in the air. So that all of those things contribute to the big brown cloud. So we also have the inversion layer. So I'm going to go a little physics on you and some meteorological education as well. Because the valley is surrounded by mountains, which makes us a valley, it forms a bowl. So normally what happens is the warm air rises up into the air and into the cold air, and then all the pollution is taken away or blows somewhere else. So when we have an inversion layer, what happens is you have that smog or that big brown cloud. You have the cold air now that kind of acts as a lid. So, and then you have the warm air on top of that, and then the cold air on top of that. So the cold air and the smog or the big brown cloud, it doesn't get the chance to disperse. So it just hangs out there. So I'm putting it into an easier version here. So I have to tout my Lions and my Wolverines here. So Ford Field is an enclosed stadium. So you think about it, and there's all those people in there, and 1 out of 100 people is having using a barbecue, not a gas barbecue, but a charcoal barbecue. Think about all the smoke and everything that these people would create, and you have a roof on there. So where is that smoke going to go? It's just going to hang out in the air, sit there at the ceiling, and drive everybody's lungs crazy. You know, another example would be anytime you watch the Super Bowl or certain hockey events and basketball events. If there's fireworks that they're using, same thing happens. You've seen the smoke in there and they have to wait for it to clear a little bit before play resumes. That's what's happening. So let me look over here on the right. Think about that example again of one in 100 people having a barbecue. That smoke is just going to go up into the air and disperse and just blow along the jet stream until it falls out of the air. So particulate matter pollution, who does it affect? Everybody. It's not just people with lung issues. It's not with people with cancer. It's everyone. So you think about a lot of the particulate matter. Anytime we have combustion, there's always a risk that it's cancer causing, that it's carcinogenic. So it affects everyone. And you know, the sad thing is that we breathe a lot of this, and so it can really impact the lungs. So who's at risk? Anybody with lung diseases. So asthma, emphysema, and chronic bronchitis. People with lung cancer. People who are over the age of 65. Current and or former smokers. Pregnant women, infants, and children. And people with immune disorders and cancer. And it doesn't apply just to lung cancer. So why is it so dangerous? It increases the mortality risk in infants. It causes increased hospital admissions for cardiovascular disease. Why cardiovascular disease? Well, part of that is when you inhale that particulate matter, it causes the veins and your vasculature to constrict, causing increased blood pressure, which has an effect on the heart. So those people that already have heart issues may have to be admitted for, you know, hypertension or high blood pressure or chest pain or angina or things that they normally don't have that they do with high pollution days. So me being an asthmatic, there are times that if I don't stay on top of my medications and I don't follow some of the rules I'll go over with you later, I can end up in the ER. And then there's sometimes when I can't break that asthma attack and I will get hospitalized. Same thing for anybody with emphysema or what we call COPD, chronic bronchitis, and lung cancer. So, and then the other thing is when I have an asthma attack or when asthmatic patients have an asthma attack, or even patients with emphysema, the attacks are more severe. So that's why they end up in the ER. That's why they get admitted and hospitalizations increase. So what does high pollution days or the particulate matter days cause on the body? So this is where we're going to talk about how it affects everyone and not just people with lung conditions. Eye irritation. It's very common when we have these big brown cloud days that, you know, your eyes are running, they're watering all the time. The eyes are affected, definitely. It also causes nose and throat irritation. You can get a runny nose, a stuffy nose. You may feel like you're having an allergy day and it's not allergy season. You notice my voice is kind of hoarse. That's part of pollution and breathing in the air that we do. Sneezing is also very common on high pollution days. So the heart and lung function, you're going to have some coughing, shortness of breath, even in those people who don't have lung disease. Bronchitis. Now this is very interesting because what the particulate matter does in the air is it can weaken your immune system. So you can end up with either a viral or a bacterial pneumonia. Bronchitis. And you get sick. You might, why am I getting a cold in the summertime? There you go. Or, you know, everybody else around me is healthy. Why did I end up with bronchitis? And it can be impacted by high pollution days. So cardiovascular issues, there can also, because I mentioned before, it causes inflammation of the blood vessels and causes them to tighten. So normally they're like this, and then all of a sudden they constrict. And you think about that in, you know, you're trying to put water through a hose and it flows nice and it's easy to get water out. And then you try to push water through a straw and it becomes a lot more difficult. There's back pressure. It's very difficult to get water through that. So think about the veins being the straw. And so that backs up and affects the heart. And that's why it can cause an increase in heart attacks. It can cause people with heart disease to have more issues. There may be even more increases in angina attacks or angina. And, it has an impact on the whole entire body. And again, too, that burning, that combustion that's created that causes this big brown cloud, carcinogenic materials in that. It's just, there's just no way about it. It happens, it's there, and it's a risk for everybody. So what can I do to protect myself? Pay attention to air quality days. I'm not saying that you have to, every day you have to check on things or go to your local news or whatever, but the news is a great place to go. Here in Arizona, I have, Arizona Family, Channel 3. I follow I have their app, so I follow the news, and it'll come up with air quality alerts when those are issued. Freeway signs, that one that I showed you that was just on the 14th of December, tomorrow is a high quality or high pollution day and a no burn day. I think I saw that today too, driving down the freeway to work. EPA has some really great resources. There's two that I like, which is the airnow.gov website and the AirNow app. And you can put in your location, what have you, and it will give you not only the air quality of that day, but it will issue an alert when that area that you're in has an air quality alert day. Stay inside. You don't, when there are really bad pollution days, and I know that there's going to be I keep saying high quality, an air quality alert, I stay inside. I try to limit my outdoor activities. And that's my next point, is limit outdoor activities. If you like to exercise outside, move it inside for a day. And go to the gym. If you like to walk, go to the mall. If there's a mall that still exists in your area, but find ways to take what you like to do and take it inside. Wear a mask. Now, I've had some people say, well, I don't like masks. I don't believe in masks. This isn't to protect you from bacteria or viruses out there. This is to protect you from the particulate matter. And it's not the surgical masks that we like to wear here in the hospital or you see people in public wearing. These are the KN95 masks, not an N95. Please don't rush out to Amazon and get N95 masks. Those, if you don't know how to use those, can be dangerous. So use the KN95 masks. Those are available on Amazon. You can find them in the stores. Those are really good for protecting your respiratory health during high air pollution days. And then don't burn. If there's a no burn day, there's a no burn day for a reason. And again, it's because of that inversion layer, and meteorologists communicate that to the EPA and everything else. And that's when these warnings are put into place. So I probably have scared the heck out of most of you, but that's not why I'm here. It's just to pay attention, and why, especially this time of year, we need to pay attention. Summertime during monsoon season, why we need to pay attention. If I'm leaving work and there's a dust storm, you better believe that I will be finding a KN95 mask and wearing it out to my car. The other factor too is living here in Arizona is the risk of valley fever. And that can be a whole other lecture in itself. But anytime that there's dust in the air, valley fever is a fungal infection. And so these little fungus balls, for lack of a better term, are carried with the wind, and they're floating in the air. And usually what we see about 2 weeks after a big thunderstorm or a haboob dust storm, we will see an uptake in patients that are diagnosed with valley fever. So be cautious when we have dust in the air. So these are some really great websites that you can use to get more information. My favorite, American Lung Association. There are so many resources available through them. The National Institutes of Health. This is actually the website here that I have for you, is their Breathe Better campaign, which is focused on air quality. Another website is the CDC. CDC has lots of information, but don't be alarmed by some of the information you see. because the CDC, what they want to do is put the information out there to protect you. So you're going to see all kinds of stuff there about maybe measles or bird flu or what have you. But, you know, you can actually search for what you want. And then another favorite of mine is the American Cancer Society. They have some fantastic resources there for air quality as well. So, you know, utilize these resources. If you see one of our respiratory, you're here at the hospital here in Phoenix or in Goodyear, and you're bopping around and you see one of us wearing this olive green color, ask questions. And if the team is, you know, a little tied up, they can, you know, refer to me, or, you know, when you're here in the Cancer Fighters Corner, if you have a question, you know, let McKinsey know, let RP know, and they can get a hold of me and I can give you an answer. And because I like to teach and I like people to be aware of what's wrong, you know, their diseases and everything else. So I think that's pretty much it. In case that you aren't aware, is we are trying to do lectures a little more often than what we are, and not so spur of the moment, but think about if you could have the opportunity to sit down with a respiratory therapist or somebody that is a vascular access specialist that puts in IVs, PICC lines, works with ports. If you had half hour to sit down with them and could ask them whatever you wanted or about a subject, think about that, and, you know, let Mackenzie know, let RP know, and we can come up with a lecture for January. So I appreciate your time. I appreciate the opportunity to provide you with this information. One quick thing though, that I was kind of almost spaced out of my mind. I get asked a lot about air filters and should I get an air purifier for my home? I would recommend that you talk to your doctor. Air purifiers, there's so many on the market, but, you know, if it was me and I was to buy an air purifier, the first thing I would look for is that it's a HEPA filter, HEPA. So that's a HEPA filter, and that it's got that filtration on it. The rest of it won't do much for you. You can buy air filters for your home that they reduce the risk of allergens in your home and supposedly cut down on inside pollution, which is dander, pollen, that kind of stuff. So there are those out there, but you need to be cautious with those because as they are thicker, they can take a toll on your air conditioner. So if you have an old system, be cautious. Air purifiers, talk to your doctor. Don't just buy one out there that you see. A good one should cost anywhere from $100 to about $500. But again, make sure it's that HEPA, make sure that it's approved as an indoor appliance, and you know, you can get them for the whole house and you can get them just for a room, but that's up to you. Me, I don't have one. I just don't, because I try to cut down on my inside pollution, but I have cats. So, you know, just be smart, you know, take a peek at what I recommend to do to protect yourself during high pollution days, and take care of yourselves and have a great holiday season. And hopefully we'll see you in January. Thank you.